morning, good afternoon, good evening po sa lahat. Saan man po kayong panig ng mundo naroon. Welcome po sa ating 105th, 105. So marami na po tayo nag-episode, no? Our 105th episode of Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being a part of our credible online community and for all those who have just discovered us for today. Welcome po at sana po masayahan po kayo for our topic for today. Very, very special po ito given we are celebrating this month specifically for this topic. At sana po ay masayahan po kayo at marami po kayo matutunan not just for today but for our future webinars. Marami pong mga eksperto ang nag-agree na yung pong benefits of the COVID-19 vaccine for people with kidney disease, lalo po at any stage, including those on dialysis or those with a kidney transplant are much greater than the risk of getting COVID. Meron pong mga pag-aaral that point to the extremely high short-term mortality from COVID that could be higher than 20%. Despite this, some patients and their family members patuloy pa rin pong nag-alala na yung pong COVID-19 na bakuna it might make their loved ones na sick. Lalo na po kasi syempre yung kanilang mga immune system medyo mahina na po, ano? So for today's webinar and in honor of June as National Kidney Month, we will be discussing the topic, epektibo ba ang COVID-19 vaccine sa mga may sakit sa kidney? I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday, our Friday lunch date po, no? Normally, I share hosting duties every Friday with my partner and dear friend, ang ating adjunct research faculty at the National Telehealth Center, si Dr. Susie. But she is traveling right now, traveling back to Honolulu. So safe travels, partner. Sana we'll be able to get back on the air again together soon. However, today is still a special day because we are joined by someone personally handpicked by Dr. Susie. She is a health communications expert. Kung nanonood po kayo ng mga health-related na mga programa po or nakikinig po pala kasi radyo po pala ito, nakikinig po na health-related na programa nung mga bandang 90s, isa po siya sa mga nag-host po ng mga ganong mga programa. So, please welcome to the webinar, Joy Flavier Alampay. Joy?
Yes, Doc. Salamat. Good afternoon, Doc Raymond. Nabuko ata ako doon. In the 90s, baby pa po ako. Kaya, anyway, thank you, Doc Raymond, for that introduction. I'm very happy to be here. Medyo ninenervyos because I have big shoes to fill. Nako, ang iyong tunay na partner nasa ibang himpapawid pa ngayon. So, ako'y nandito para mag-welcome sa inyong lahat. Salamat sa TVUP for your invitation and of course thank you for having me kasi parte na ako ng Stop COVID Deaths family. Okay ba yun, Doc?
Okay.
Anyway, yes, sa ating live stream, welcome kayo andito sa ating mga live stream. Ang pwede nyo panuorin kami sa TVUP YouTube channel, UP System Facebook, TV, UP Facebook, and of course, the Stop COVID Deaths Facebook pages. Ano? So, kanina sa ating billboard opening, may napansin ako, Doc, may bago tayong expanded definition ano, sa ating Stop COVID Deaths. In our title, ang COVID, ang ibig na sabihin ngayon ay letter C, current COVID-19 problems, O, other outbreaks, V, viruses, letrang I, infection, si D po ay infection sa yung titik E. And D, disaster. So marami na po tayong ibang topics na pag-uusapan and we can take a closer look at other emerging health problems sa ating mga community while keeping an eye still on the COVID problem and the developments here and abroad. Okay po ba yun, Doc Raymond? So since we know that you always like to be abreast of the latest news in health. Sabi ko nga, hindi lamang po sa Pilipinas, kundi abroad, we have a new segment. Ang tawag po dito ay News Updates. Okay, so here are some of the stories that we're keeping an eye on and why they are very relevant to you. Sa bandang Espanya, hindi po sa UST Espanya, kundi sa Spain. Spain denies this regional report of first cholera infection since 1979. 40 years ago kasi ang last case nila ng cholera. Ang sabi ng Health Ministry ng Spain, hindi po ito cholera, kundi gastroenteritis. May female patient silang na-detect na nung una pinagsuspetsahang cholera, pero ito po ay nag-undergo siya ng more tests, Doc, and yun pala, ito po ay cholera. So, sa ibang banda, Doc Raymond, meron ka pang news updates para sa atin?
Yes, that's correct, Joy. So, obviously, there are those na nakaabang po dun sa, meron po kasi Moderna na vaccine na very specific po for Omicron. The news update that I have is related to that somewhat dahil po meron pong bagong resulta ng pag-aaral na nagsasabi po na yung pong mga tinamaan ng Omicron na variant kumpara sa mga tinamaan po ng Delta variant, mas mababa po ang chance, they are less likely to develop long COVID symptoms compared to those who were infected with the Delta variant po. And this is adjusted against, so according to age, to gender, to the vaccination timing. So lahat po yun pinonsidera and they found na kung kayo po ay tinamaan ng Omicron, although it's much more contagious, that's still part of the literature and also of the evidence, you are less likely to develop long COVID symptoms. So just so you know, kasi po long COVID remains study of concern po in terms of trying to get more details with regards to long COVID. And this may be something we should keep an eye on. And that's the latest news for today.
Okay, the COVID pandemic has definitely put an additional strain on patients with kidney disease. Ang dami-dami po nagkaroon ng limited access sa ating mga dialysis centers, yung kanilang mga schedules hindi nila napupuntahan at dahil nga daw po, dahil sa ating mga lockdown, no, many patients miss their schedules. So when vaccination was introduced, immunocompromised patients were identified as very high priority for receiving the vaccines. So new hope emerged nung nagkaroon tayo ng napakagandang programang vaccination. In this episode of Stop COVID Deaths, we will tackle and take a closer look at COVID-19 vaccination for patients, specifically po sa mga may kidney disease, and in particular, those who have had a transplant. Medyo small po yung population nun, pero nevertheless, still very important, ano? And it is often encountered and frontliners should be equipped with information to guide families on a course of action to address their concerns. So, Doc Raymond, let's listen to what the people on the ground are thinking and saying.
Thank you, Joy. For those who are joining us for the very first time today, we usually take the pulse of the common person on the street through what we call the person on the street video. So dito po, ang katanungan po namin na itinanong sa ating pong mga interviewees, mabisa ba ang COVID-19 vaccine sa mga may malubhang sakit sa kidney? Please watch this.
Yung father ko, meron siyang kidney stones na kailangan operahan. You know, day-to-day, parang maintenance medicine yan.
Meron po akong kaibigan na merong sakit sa kidney. Alam ko po, mahina na po yung kidney po niya.
Tito ko, na kapatid ng nanay ko, may sakit siya sa kidney and currently nagdadialysis siya.
Yung sakit ko, kidney chronic disease siya, stage 5, dahil yun sa staghorn calculi. Ano yun, hindi namin naagapan kaya nasira yung left kidney ko. Kaya nung na-detect yun ng doktor, for emergency dialysis na siya.
Sa tingin ko naman po, ang COVID-19 vaccine ay effective pa rin para sa mga may sakit sa kidney.
Wala namang naging side effect or naramdamang sakit after vaccination maliban sa given na nagkakalagnat, masakit ang katawan.
iba yung nabibigay sa vaccine. Siguro more of, kung may side effects man, is more of yung parang nilalagnat tayo or masakit ulo, pero ang use talaga ng vaccine is to protect us from COVID.
Yung tito ko kasi dati, ayaw niya magpa-vaccine kasi nga, nung early rollout ng vaccines, parang ang daming mga lumalabas na side effects sa mga may sakit, kaya ng sakit sa kidney, mga nagda-dialysis lalo.
Nagpa-vaccine na ako. Nung una talaga, ayaw ko magpa-vaccine. Kaya lang kasi, requirement kasi yun sa, namin, dialysis center. Parang kapag hindi ako nagpa-vaccine, kailangan kong, laging, magpa-swab test. Sa vaccine kasi, parang nakakatakot lang. Hindi ko kasi alam kung magkakaroon ng complication tsaka kung kakayanin ng katawan ko.
Gaya na sa tito ko, medyo malala yung sa kidney failure niya. So, madalas siya magpa-dialysis and minsan parang lantang gulay yung itsura niya. Pero wala namang naging side effects sa kanya yung vaccine niya.
Based on sa nakita ko, my father's side, wala namang naging complication na may kinalaman sa kidney.
Complicated pagdating sa mga papers. Pero sa mismong dialysis naman, pag nandun ka na, wala naman problema. Nilagnat ako ng 3 days. Nilagnat ako tapos hindi ako nagpapa-BP dito kasi namaga siya. Yung dito sa right arm ko, namaga siya. Yung nararamdaman ko, masakit yung katawan ko bukod sa nilalagnat ako. Other than that, wala naman.
Yung may mga gantong klaseng sakit, yung mga kidney problems or kahit ibang sakit, is mas may high risk sila na mahawaan.
Mas doble ingat na lang po para hindi po magkaroon pa ng iba pang sakit.
Tayo na lang din kasi mag-iingat sa sarili natin eh. Kapag naramdaman mong hindi maganda, mag-consult ka kaagad sa nepro mo or sa doktor mo para at least maagapan.
Thank you so much, TVUP. It's really nice to get the pulse of the people. Many times po kasi the healthcare practitioners tend to forget some things, and obviously we know a lot of things are not necessarily shared to a lot of people. So getting that sort of ano po ba ang alam po nila with regards lalo po sa bakuna, at kung may sakit kayo sa kidney, kung okay ba to, mabisa ba to, lalala ba ang sakit ko sa bato, kung matusukan po ako nito. Ano po ito it's really, these are worries and concerns that we should not be dismissing ng ganon lang. So maraming salamat po. Before we proceed, we'd like to do a little bit of housekeeping, and for all those who are asking, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out the certificates for webinars 1 to 103. Meron pa pong konti for 104. So kung meron pa pong hindi nakakatanggap ng kanilang certificate, lalo na kung 103 pabalik, please let us know by emailing us at stopcovidets@up.edu.ph. Joy?
Yes, Doc. Siguro pwede na tayo mag-proceed sa ating topic at hand, ano? Napaka-exciting nito kasi ako gusto ko rin talaga malaman ang additional at bagong impormasyon because my own father passed away due to renal disease. So, importante ring malaman natin yan para sa sarili nating mga pamilya, maiiwasan natin ito. So today, our panel is composed of the leading experts on renal diseases and infections in the country. So ayan, together they will shed light on how safe it is to give vaccines. Sabi nga natin, no, marami pang medyo hesitant, pati yung boosters to patients who are immunocompromised, especially to our kidney patients that have chronic renal diseases, or to patients who are undergoing treatment for cancer, di ba, for example.
Correct. So, lalo na po, for the benefit of those who are joining us for the very first time, we usually employ a standard panel discussion format. Our speakers will give their presentations. We'll have a quick Q&A session. wherein questions coming in either dito po sa Zoom, Facebook po yan, o kaya YouTube po. We will be scanning po the comment section and then the chat section kung wala po sa Q&A dito sa Zoom for us to be able to choose kung ano po yung mga questions po that we can entertain as part of the Q&A. Joy?
Ayan. Yes. So, aantabayan na namin ang mga tanong nyo. No? Maraming bumabati sa atin. Hello, hello sa inyong lahat mula sa lahat ng UP systems at sa mga iba pang lugar. Pero yun nga, pwede po kayo magtanong, i-type nyo lang po sa ating chat box. And again, we are being live streamed via TVUP YouTube channel, UP System FB page, TVUP FB page, and of course, the Stop COVID Deaths FB page. So Doc, before we start the webinar, medyo may exciting at cute part tayo ngayon, the fun quiz. So here, we have our fun quiz segment for all of you.
Hello? Hello? Hello?
Kumusta na kayong lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Galing talaga ng animation po natin. Thank you so much to TVUP. May we have it on the Zoom screen also po, not just on... Thank you so much. So for the benefit of those in the Zoom, you will be able to see the polls and quizzes pop-up window for the 2 questions, and also those who are joining us outside of Zoom. If you open your browsers, go to slido.com and input the code 5405717. That's 5405717 for you to be able to join in our fun quiz. Our first question, safe po bang magpabakuna kung option A, chronic kidney disease, option B, nasa dialysis, option C, after kidney transplant, or all of the above? So, yun po ang ating unang katanungan. Obviously, there are those who are joining us saan po, no? Sa UP, from Pasay City, Barangay 84, from Northern Mindanao. Maraming salamat po sa inyong lahat. Also, greeting those from Angeles University Foundation Medical Center in Pampanga, the Cebu Provincial Hospital in Carcar City in Cebu, Provincial Government of Negros Occidental in Bacolod City, and Zamboanga del Sur Medical Center in Pagadian, and St. Elizabeth Hospital General Santos City in South Cotabato. For our second question, hello po from Montalban Rizal and Santa Ignacia, Tarlac. Second question reads, yes or no lang po ito kung may sakit sa kidney, dapat pa bang magpabakuna laban sa COVID-19 kung kayo po ay nagka-COVID na? So, most of those who are participating are choosing yes. Mas marami lang po sa Zoom kaysa po sa Slido, but we'd like to get your answers po dito po, no? Sa ating second question as part of our fun quiz. Also, internationally, we are being viewed. We have attendees from the Chonin Hospital in Taipei, Taiwan, Kanto City in Vietnam, the Dammam and University of Haiel in Saudi Arabia, in Doha, Qatar, and the Philippine Nurses Association in Edmonton, Alberta, Canada. So, hindi po muna namin i-close itong fun quiz na ito as we move on to the webinar proper. Joy?
Doc, bago ang lahat, pwede ba akong sumali? Parang napaka-exciting na yung mga premyo. Anyway, yes. Yes, nandito na po tayo sa ating webinar proper, and we're gonna get our discussions going and underway. So I will be introducing our first speaker. She is very familiar to most of you because she has been a regular here in Stop COVID Deaths. Please give a warm virtual welcome to the Deputy Director for Medical Services and the head of the Hemodialysis Unit of the National Kidney Transplant Institute, Dr. ROMINA DANGUILAN. Doktora, welcome po sa Stop COVID Deaths, Webinar 105. Please.
So much. I'd like to thank the UP group for inviting me to give this talk. I miss Dr. Susie, ha? Hi.
Dr. Penji, she misses you also. And it's
Good.
been a while since we've had you. So we are appreciative of the fact that you're lending your time to give us a talk po. Salamat po.
Thank you, Doc Raymond. Can you see my slide, Doc?
And if you can go to, yan, there we go. Sige po. Go ahead, ma'am.
Okay, so in celebration of National Kidney Month this June, I'm sharing with you our experience, this time with the vaccination. So the title of my talk is COVID-19 Vaccine Efficacy in Patients with Kidney Disease. And these are my disclosures. So here I would like to show you just the incidents to give us some context about the problem, which is all too familiar to all of us. This is the WHO COVID-19 dashboard, looking at it globally. So we already have all of this, 535 million cases. And here is the Philippine data. We have 3.6 million cases as of June 17 this year, and 60,461 have died. This is the national incidence and prevalence of dialysis patients. In your interviews a while ago, you were really concerned about, how many patients are on dialysis, and this slide shows to us that in 2016 we already had 35,000 patients on dialysis, and I just wanted to extend that because the PRDR is still going through their data, that maybe by now, 2022, we already have about 60,000 patients on dialysis, and this is for the entire country. On the other hand, I also wanted to share the number of kidney transplant patients that we have. And you can see the huge disparity. There's a very large gap between patients who are on dialysis and patients who have had a kidney transplant. So for kidney transplantation, we only do about under 300 cases here at NKTI, and for the whole country, maybe about 500 a year compared to all these patients on dialysis. Now, going to COVID, these are the risk factors that have been found to be increasing the risk for mortality and really very severe disease when the patients get COVID-19. So we have the elderly, we have those with cardiovascular disease, then those who have diabetes, those who have chronic kidney disease, or these are some of the medical conditions, and we're going to really talk about this in more detail. Patients with obesity, with chronic lung disease, and the immunocompromised population, so that's patients with cancer and organ transplant patients. Again, we will center on patients who have had a kidney transplant. And if we go back to that dashboard of the Philippines, I just wanted to show to you that in a regular population, or if you take everybody as a whole, we have 1.6% death. I want you to remember that number because I want you to see how it compares with patients who have CKD. And this is a paper that we just published this year, looking at the outcomes of CKD5 patients with COVID-19. So in this paper, 436 dialysis patients were admitted for COVID-19 from March 13 to August 31. That's just 5 months. And here is a picture of our tent where we had to put a dialysis machine early during the COVID pandemic. So here we had 68% who were on HD, 24% were on peritoneal dialysis, and 18% of the patients just started dialysis when they were admitted. And the overall mortality was 34%. But if you look at the HD population, their mortality was 38%, PD 20%, and dialysis initiation was 37%. This is so high compared to the previous slide where I asked you to remember 1.6%, which is the mortality among, if you look at the whole population. So really, patients with CKD on dialysis have really a high mortality when they get COVID-19. Now, these are the outcomes of CKD patients with COVID-19. And I just wanted to show to you the survival estimates. And here you see in the red line, patients with peritoneal dialysis, that they survive better. Why? Because the patients are usually dialyzing at home, so they don't really get infected, no? Because HD, they have to go to a dialysis center, and therefore they're exposed to other patients and to the healthcare workers as well. And so there was a significantly better survival of PD compared to HD and compared to dialysis initiation. Now, whether the patients were on HD or dialysis initiation, there was no significant difference there. Now, let's look at that, our data, and compare it to what is available in other countries. So here, ours was 34%. Look at this Italian study, which was a 34% mortality among dialysis patients, and in Spain, 35% as well. In the US, it's about 26%. And this is a very interesting meta-analysis, also published last year. And here they found a 22% mortality. And how did they do that meta-analysis? Well, they started with all potentially related articles looking at mortality or incidence. So from 220 articles, they brought that down to 116 articles and ended up with 29. 22 looked at incidence, 22 looked at both incidence and mortality, and 27 articles looked at mortality for this paper. Here, I just wanted to show to you all the countries that were involved in this paper, and that majority of the patients were, or the papers were coming from China. And I just put here in red mark the number of dialysis patients they were reporting from the various countries. And look here from Japan. I guess this is a registry report, but 339,000 patients on HD. Italy, more than 30,000 patients. And from China, about 6,000 to 7,000 patients. And if you look at this result, looking at our mortalities, you can see that for all of the countries, you can see the variation in the mortality, and it ended up to be about 23% mortality rate among dialysis population. So let's proceed. And I guess what kidney patients need to know, as shown in the ABC, should I get the vaccine? And this is a summary of the COVID-19 vaccine efficacy in our CKD patients. So this looks at CKD stages 3 to 5, not on immunosuppression. Because as we know, depending on the cause of your CKD, if you had glomerulonephritis, some of the patients might be on steroids. And in this population, the efficacy of vaccines were decreased because of the alteration of innate immunity by the uremic milieu, because creatinines are already elevated, GFRs are already low, so there's a lot of metabolic imbalances already existing in the patient, and because of that, may result in a decrease in vaccine efficacy. Of course, we have again the elderly patients, so our mean age of dialysis patients is about between 50 to 60 years old. And they even postulated vitamin D and EPO deficiency. Looking at patients on CKD stage 3 to 5 who are on immunosuppression, they also found that chronic steroid use might decrease the generation of neutralizing antibodies. Therefore, a booster vaccine might need to be considered. And once the patients are already on dialysis, again, they noted impaired immune systems in CKD patients, resulting in a difficulty in establishing sufficient adaptive immunity against SARS-CoV-2. So from this review, it looks like, yes, because of the high mortality associated with having CKD or being on dialysis, that the patients do need the vaccine, but perhaps because of a lower response to that vaccine in terms of antibody production, that they may need that booster. Now let's go to COVID-19 in kidney transplantation. And again, I wanted to show to you again the incidence of our patients on dialysis versus KT, showing to you that gap. And in fact, these are the number of kidney transplants being performed nationally, that's the blue line, versus in NKTI, which is the red line. And you can see here that in 2020, when we had that COVID-19 pandemic, there was a sharp decline in the number of patients being transplanted. As you know, we had to close the hospital for a certain month because everything was geared towards treating our COVID patients, and all elective operations were stopped. But since then, we're happy to report that there has been an increase already as hospitals opened up, as we already started to know how to cohort these patients and maintain hospital operations despite surges. So now kidney transplantation continues. And you see that there's already an increase since last year. This is a study looking at the significant risk factors. Again, this is a systematic review and meta-analysis. And this was actually made by a PHI group. And they noted that kidney transplant recipients with COVID-19 are at higher risk of death than general population. And they looked at all prospective and retrospective studies of COVID-19 in kidney transplant recipients. And from a total of more than 1,000 articles, 13 articles were finally included, which looked at more than 4,000 patients. And they found a mortality of between 12 to 32%. So you see a lower degree of mortality as compared to patients on dialysis. So, however, it is still higher than the general population, which in the Philippines is about 1.6%. And they found that there was a significantly increased risk factor for death among the elderly, those who received the deceased donor, diabetics with cardiovascular disease with active cancer, dyspnea and pneumonia at presentation, those who develop acute kidney injury, those with elevated inflammatory markers such as CRP, procalcitonin, and IL-6. And so that in kidney transplant recipients with COVID-19, the immunosuppressed status in KTR might contribute to the higher mortality rate. Empirical stepwise reductions in immunosuppression are recommended in patients at high risk of developing severe disease and as clinical severity of COVID-19 symptoms increases. So when the patients are admitted with COVID, depending on the severity of COVID, we will reduce their maintenance immunosuppression. Also, SARS-CoV vaccination has become the standard of care for the prevention of severe infection, and KTR mount lower antibody responses following SARS-CoV-2 vaccination compared to healthy individuals. Well, happy to say we've had very good vaccination rates. I think in the Philippines overall, with all these different groupings as to prioritization, we've already vaccinated, at least with the primary series, about 60 million Filipinos. But you see, we do still have a long way to go for that booster shot. And this is a paper that I'd like to share with you that we just completed. Vaccine efficacy in kidney transplant recipients hospitalized for COVID-19 here at the NKTI. And I show here to you the Sec Duque coming into the NKTI where we started the booster vaccination, and our director, Dr. Liquete, receiving that shot. So this is a single center retrospective cohort, including all adult Filipino kidney transplant recipients, more than 19 years old, who were admitted for COVID at the NKTI from March 1 to December 31, 2021, with a positive COVID-19 RT-PCR. And we needed to take in 207 patients to achieve that 91% power. So here are our results. So we were able to get 207 patients, and we divided the groups as to those who were vaccinated, which means they completed the primary series, and those who were unvaccinated, and this included those who received partial vaccination or were unvaccinated. Median age was 50 years, and majority of our patients were males. And this is looking at the severity of the patients who we admitted. So mild was only 18%, moderate was 46% of patients, severe 27%, and critical 9%. These are the demographics and baseline characteristics of our patients. And here I put in red those that were found to be significant. Here you have the different groups according to severity. And we found that males with hypertension as their comorbidity had more severe disease. You can see that among those with critical patients, 83% there were males, 72% here had hypertension. We also found that older grafts had more severe disease. That was significant as shown here, telling us that those who were longer post-transplant, here 120 months, they tended to have the more severe disease. And this slide showed to us, because we looked at the immunosuppression that they were on, and we found that steroid use had more severe disease as well. Here you see that 100% of patients who were on steroids had that severe to critical disease. This is a very interesting slide showing to us that there was a higher mortality among the unvaccinated patients. So here we looked at the table dividing the patients as to those who were vaccinated versus unvaccinated. And the higher mortality among those who were unvaccinated, almost 70% versus only 30% mortality if you were vaccinated. We also found a greater severity of COVID-19 on admission among the unvaxxed. So when they were admitted, those who were unvaccinated had critical and severe disease compared to those who were vaccinated. So it seems really that vaccination is able to prevent that severity of the disease. Sorry about that. Here we also found that there was more progression during hospital stay among the unvaxxed. So 74% of the unvaxxed tended to progress in their disease even while they were admitted, compared to only a quarter of patients. And here overall, there were worse outcomes among the unvaccinated. Here we see acute kidney injury requiring dialysis, 70%, graft loss in 80%, and cardiac events in 64% versus those who were vaccinated. This is a slide showing to us the survival by vaccination status. And here, the blue line refers to those who were vaccinated, and the red, those who were partially or unvaxxed. In the beginning, up to the first maybe 10 days, you see that the lines were the same. But as the patient's length of hospital stay increased, that if you were vaccinated, then your survival was about maybe 80% compared to the declining survival among those who were unvaxxed. Again, worse outcomes for kidney transplant recipients in the unvaccinated. They required more oxygen, needed an ICU admission, required invasive mechanical ventilation in 66% versus 33% among the vaccinated, developed AKI or acute kidney injury, required dialysis therapy, lost their grafts, 80% among the unvaxxed versus 20% among the vaccinated. Again, mortality, 70% among the unvaxxed versus 30% among those who were vaccinated. And again, those who had a cardiovascular event, in about 65% of those unvaccinated versus 35% among those who got the vaccine. This is a slide showing to us that there was a significantly decreased graft and patient survival of kidney transplant recipients according to the disease severity. Here you see that among those who lost their grafts, that were 34 patients, majority of the patients had critical disease. And patient outcomes, again, 94% of those who had critical disease died. Okay, that is something that probably is very logical. But let's look here at the graft and patient survival according to vaccination status. If you look at graft loss, which is the red bars, looking at graft outcomes, 13% lost their graft versus only 3.4% if they were fully vaccinated. On the other hand, looking at patient outcomes, 18% of those patients died compared to only 7.7% who were fully vaccinated. Therefore, conclusions for CKD are that CKD is a risk factor for severe COVID-19 and mortality. There's a higher risk of mortality in CKD patients versus the general population, 1.6% in the general population versus 34% as shown with our data. There is decreased vaccine efficacy in CKD, and CKD patients should receive regular vaccination and even booster doses during the SARS-CoV pandemic. What are our conclusions for kidney transplant patients? COVID-19 vaccination was effective in preventing severe disease in our kidney transplant recipients. COVID-19 vaccination resulted in better outcomes, including less oxygen requirement, ICU admission, mech vent requirement, AKI, requirement for dialysis, and even cardiovascular events. There was a decreased graft and patient survival in patients with critical disease, and graft and patient loss was higher among the unvaccinated patients. Now, you know our patients got COVID despite that population receiving the vaccine. So there was vaccine breakthrough, and this will be discussed more by our second speaker, Dr. CYBELE. So before I end, I'd just like to show to you that it's Kidney Month, and our theme was Patong Malakas sa Panibagong Bukas, and that NKTI has been very, very active, doing a lot of activities. In fact, ongoing now is the GN or glomerulonephritis masterclass. We also have ongoing peritoneal dialysis webinars, which will run until the first week of August. We also have vascular access workshop and a PD catheter insertion workshop, and always a tribute for our organ donors. Without them, we will have no kidney transplantation. And leptospirosis is going to become more common now that the rainy season is here. So we also had that lay forum. And I'd like to thank you so much for your for listening. Back to you, Raymond.
Thank you, Dr. Penji. Bili po kami sa ginagawa po ninyo sa National Kidney and Transplant Institute po, no? So, very, very thankful for really something impressive po in terms of the comprehensiveness.
Thank you, Doctora.
On vaccine efficacy in kidney transplant patients po. Hope you can join us later, the Q&A session, Dr. Penji. But before we introduce our next speaker, we'd like to remind everyone na meron po tayong box dito, no, sa ating Q&A part dito po sa Zoom. And we hope you'll be able to input already kung ano man po ang inyong mga katanungan with regards to kidney or COVID vaccine in the kidney and the like.
Yes.
We often choose from the list of questions kung ano po yung most upvoted, yun po yung itatanong po. And so we urge everyone, encourage everyone to start typing in your questions. And for those who are in Facebook and in YouTube, please put them in the comment section po. Our next speaker naman po is not really bago po sa inyo. We've had her previously in one of our COVID-19 webinars. She is the clinical associate professor at the UP-Philippine General Hospital on infectious diseases, and she is also the chair of infection control at the Medical City. So please welcome back to your screens, Dr. CYBELE Abad. Dr. Abad.
Hello, good afternoon. Thank you so much for having me again. Thank you to Dr. Penji for thinking of me for this webinar. And let me just share my screen here. So this is a follow-through from Dr. Penji's lecture. So this time we'll try to prevent COVID-19 from occurring among kidney transplant recipients and transplant recipients in general. So we'll talk about boosters, breakthrough infection, and antibodies among solid organ transplant recipients. So the biggest limitation is that the evidence or the data on solid organ transplant recipients involves really the use of mRNA vaccines such as Pfizer and Moderna. And I know earlier on during the pandemic, we actually did not have these vaccines. So many of us got vaccinated with other types of vaccines. So just a brief outline of this discussion. We'll go over background and some definitions of terms. In addition, the vaccination schedule in transplant recipients. We'll review the evidence on vaccine efficacy with a third and subsequent doses and why it's sort of used as a response to monitor antibodies. I know Dr. DANGUILAN mentioned that earlier. So that's a surrogate measure of response to vaccines. We'll also talk about risk factors that may affect the response to vaccination. And then we'll talk about a common question, which is, do you still need vaccination despite having COVID-19 infection? Because many got Omicron back in December and January. So the question really is, do they still need to be vaccinated? And then we'll end with some key points before we open the floor to questions. So let's start off with definition of terms. So when I say SOTR, it's not, it's very close to LOTR or Lord of the Rings, but it really means solid organ transplant recipients. When I say immunogenicity, it's a measure of the immune response. Unfortunately, we can only measure a part of the immune response. And we do that by measuring humoral immunity, which is a measurement of antibody. And against COVID, it's usually a measurement of antibody against certain parts of the COVID particle, which is the spike protein, the anti-receptor binding domain, or the nucleocapsid. But in essence, they're just small parts of the viral particle. Or there's also what you call a neutralizing antibody. And this is an indirect measure of how effective it is in terms of killing the COVID-19. The other measurement of immunogenicity is by a measurement of cellular immunity, which is measuring the T cell response, or what you call a CD4 cell. Now, we also have to differentiate a booster from a third dose. They're often used interchangeably, but there's a very subtle difference. So the booster dose is actually the dose that we get as part of the general population when we think the sufficient immune response to the primary vaccine series, so after our 2 doses, has started to wane over time. So the initial response was sufficient, but it's starting to decrease over time. In contrast, the third or additional dose is actually considered part of the primary series. So instead of getting 2 doses, they get 3 doses because the initial response to 2 doses is actually insufficient. So this is what we actually give our transplant recipients. So the premise is really this: there is poor vaccine efficacy with 2 doses. As you could tell earlier with the study of Dr. Danguilan, those who were vaccinated still got breakthrough disease, especially among solid organ transplant recipients. And in general, if you are healthy, the vaccine efficacy of the mRNA vaccines is around 80 to 95%. But if you're a transplant patient, this drops to about 30 to 50%. Thus, because of the weak antibody response after 2 doses of the mRNA-based vaccines, there is now approval for a 3rd dose for transplant recipients. This is their proposed transplant vaccination schedule. So this is taken from the American Transplant Society, but a lot of other societies, including the International Transplant Society, has borrowed this schedule. So if you look on top, because Janssen has already fallen out of favor, so let's just focus on Moderna and Pfizer. As you can see, they give first doses and then the second dose either 3 or 4 weeks after, and then they get the 3rd dose, which is not yet their booster but part of the primary series, and then after 3 months then they get their first booster, which is the 4th dose, and now they're thinking about yet giving another 5th dose or the 2nd booster, and we'll talk about that later on. So now the 3rd dose is called the charm. So the 3rd times the charm, and the 3rd dose increases the hope that the solid organ transplant recipients are now responding to their primary series. Now, what is the evidence behind it? It's actually just a very small randomized controlled trial because solid organ transplants during the pandemic are few and far between. But what they did was they gave 2 doses, so that 0 and 1 month of the mRNA vaccine Moderna. And then they gave the 3rd dose at 3 months after this 2nd dose. And they compared it to placebo. And the primary outcome that they looked at is the antibody response, excuse me, to the anti-receptor binding domain. And they said that if you have an antibody level of over 100 at month 4, then that's considered successful. So if you look at to the left first, the baseline characteristics, these are kind of the older population with a median age of 66 years. And the median time to transplant was around, or rather from transplant to the 3rd dose was around 3 years. So that would just mean that these patients are already stable after transplant. So these are not newly transplanted patients. Now, if you look at the diagram to the right, and we'll go from A to D. So looking at the A panel first, the anti-RBD antibodies after the 3rd dose, as you can see, the mRNA has a higher antibody compared to the placebo, which makes sense because placebo really does not contain anything. And the bar over here is the median antibody response, which is above 100, which is their goal. If you look at here to the right B panel, you find that the anti-RBD antibodies before and after the 3rd dose, you find that there is an increase after the 3rd dose when they're given the mRNA vaccine. And then for the C panel to the left, bottom left, you find that the neutralization, so now they're looking at neutralizing antibodies, which we talked about. The neutralizing antibodies increased after the 3rd dose, and there's no, of course, substantial increase with placebo. They also tried to look at the CD4 response or the cell-mediated immune response of these recipients, and they found that the response was rather robust, as you can see here, compared to placebo. So as such, the key findings of this study show that this 3rd dose of mRNA vaccine had substantially higher immunogenicity compared to placebo. However, the big caveat is that it's a short follow-up study, just a month after being given the dose, and really was not powered to detect differences in clinical outcomes. So as a clinician, what we're after really is does it prevent severe COVID-19. We don't really care what the antibody response is, so to speak, because it's just a number. We're after clinical outcomes. And the authors did say that the cutoff value of 100 of the antibody response is rather arbitrary and really does not mean that it's predictive of resistance to infection. So since then, however, there's now a real-world effectiveness study. So it's a population-based study in Canada, and it included close to 13,000 solid organ transplant recipients. They began giving them their third dose by August of 2021. And again, majority of the vaccines are mRNA, including Moderna and Pfizer, and a few got AstraZeneca. At this time, however, the circulating variant was Alpha and Delta, so there was no Omicron yet. The primary outcome is now looking at preventing SARS-CoV-2 infection. So if you look at the results of this study, so they compared those who are unvaccinated, those who got 1, 2, or 3 dose vaccines. And if you look to the far right, the adjusted vaccine effectiveness did increase with the increase in number of doses of vaccine. And then if you look at clinically important outcomes, you find that the preventing bad outcomes such as hospitalization and death also improved with more doses of vaccine, as you can see here. But note that the vaccine efficacy is not as robust or as high as we want it to be, because it really ranges from as low as 11% to as high as 87%. So really, transplant recipients have a hard time responding to the vaccines. So to highlight, vaccine effectiveness in solid organ transplant recipients is really lower than the general population, and effectiveness is thus improved following a third dose. However, this is pre-Omicron, and we don't really know if a third or a fourth dose is effective because the circulating strain is now Omicron. So what about a fourth dose, which is now considered the first booster, and other subsequent doses? The CDC actually has no strong recommendation for the fourth dose and subsequent doses in their manifesto, so to speak. They will just put it as consider a fourth dose. However, I talked to some transplant physician colleagues abroad, and they said they are now routinely giving the fourth dose for their transplant recipients. So this is an example of a single center study where they've started giving out the fourth doses. So it's a very small study of only 18 solid organ transplant recipients, of whom majority are kidney transplants. So 11 out of the 18 were kidney transplant recipients. So they checked the antibody titers after 3 doses, so before the fourth dose. And when they checked after 3 doses, 6 still had negative titers, 2 had low positive titers, and 10 had high positive titers. They checked the titers again after 4 doses, and they saw that 63% were boosted from being negative or low positive to being high positive. However, there still remained 3 people who were negative after 4 doses, so they were really non-responders. If you look at it in terms of a graphical pie, you find that the piece of a pie where they started to respond increases in parallel to the numbers of doses they received. So to conclude, perhaps it's not 3's a charm, but it's lucky 4. So perhaps they need 4 doses, especially for those who are poor responders. Now, what about variants of concern? And this is where Omicron comes in. It is still unclear whether a fourth dose elicits antibodies capable of neutralizing these variants of concern, including Omicron. So as you can see here to the right, this is again a single center cohort of just 25 transplant recipients. Again, majority are kidney transplant recipients. Almost all of them are on immunosuppressives, and close to 70% are on triple immune suppression. In terms of the number of days from dose 3 to dose 4, it's about 3 months or 90 days. And days in terms of antibody measurement, it's about a month after the fourth dose. And again, they use just Moderna and Pfizer. So if you look at the antibody response to the different parts of the viral particle, so they checked that the antibody response to the nucleocapsid, the anti-receptor binding domain, and the spike protein, you find that pre and post, there was an increase in antibody response. However, if you look at the fourth dose versus variants of concern, if you still remember the Delta and the Alpha and the Beta, the increase were modest, but if you look at the Omicron below here, there really was no change before and after the fourth dose. So although this cohort may not be representative of all vaccinated transplant recipients, it does reflect the concerning subgroup of patients who seem to be at high risk for Omicron despite receiving 4 vaccine doses. So there's really a small percent of transplant recipients who do not respond, especially to this particular variant. So the other new thing is that many studies have started measuring antibody response and tried to look at risk factors. How come there are transplant recipients who do not respond to 3 or 4 doses of vaccine? But remember, however, that the antibody response is a surrogate measure and it does not really represent clinical efficacy. Nevertheless, this is a meta-analysis that looked at almost 12,000 recipients. And when they looked at the antibody response, looking at 1 dose, 2 doses, 3 doses, and 4 doses, you find that total seroconversion, which is in blue bars here, so it increases in parallel with the number of vaccines. So it's highest with the 3-dose vaccine. Unfortunately, there was only 1 study that was included that looked at the 4th dose because they're only starting to roll it out, but it looks like it's higher compared to the 3-dose vaccine. Now, new seroconversion means that's the only time they seroconverted from 0 antibodies to a good antibody level. So as you can see, there's also some seroconversion with the 4th dose and the 3rd dose. Now, when they looked at the risk factors, and this is actually very similar to the study that Dr. DANGUILAN presented earlier, the risk factors responsible for a poor immune response include older age, more recent or deceased donor or cadaveric transplants, the use of anti-metabolites such as your mycophenolate, and the use of antibody-depleting agents such as rituximab and thymocyte globulin. So as you can see, they're to the left of the forest plot here, and there really was no risk factor that provided a positive humoral immune response, with the exception of maybe the use of the mTOR inhibitor, which is typically your tacrolimus. But as you can see here, the confidence intervals are very wide, so it's not very convincing that it's protective. Now, the question that we are often asked is not just for transplant recipients, but for everybody, is if you've had COVID-19, do you still need your vaccines? And the short answer is yes. Everybody still needs that vaccination. And I'll show you why in the next slide. So this is a study in the general population. There's no study yet in the kidney transplant or the transplant cohort, but these are 2 large studies, one in the UK. In the UK, of 35,000 participants, 9,000 had prior COVID and 26,000 did not have COVID. Now, for those with prior COVID and no vaccine, their vaccine efficacy decreased about 70% at 1 year. But if you had both COVID-19 and a vaccination, your efficacy was still at 90% after 1 year. In contrast, if you didn't have COVID-19, but you had your vaccine, so vaccine alone, that vaccine efficacy really wanes over time to just 50%. Now, this larger cohort from Israel, around 150,000 participants, all with prior COVID-19, when they looked at those who were not vaccinated, the risk was around 10.2 per 100,000 per day, while those who were vaccinated and had COVID-19, the risk went down to 2.5 per 100,000 per day. So this just goes to show that the best immunity is really hybrid immunity from illness and vaccination. So some take-home points before I open the floor to questions. The 2-dose primary series is unfortunately lacking or has low vaccine efficacy for transplant recipients, and a 3rd dose is really highly recommended. A 4th dose or their first booster should be highly considered. Subsequent doses are still being studied, and vaccine should be given despite having prior COVID-19 infection. Thank you very much for listening. I will be happy to answer questions. I'll give it back to the host now.
Thank you so much, Dr. CYBELE. That was so enlightening, no? There's ang daming bagong breakthroughs, especially for in addressing those that have the SORTs and the other kidney transplant patients. So before that, I'd like to congratulate you and Dr. Romina for all the information and the campaigns you've been having. Yung Batong Malakas sa Panibagong Bukas is such a catchy campaign.
Whoever
So
thought of that should be commended. Ang ganda.
right. Oo.
Recall.
Tsaka correct. And I guess hindi lang tuwing Hunyo natin yun magagamit. It can still, continue with the information drive. So before we go to our question and answer portion, meron po tayong mabilis lang na public service announcement.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpi-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh, natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18 years old.
Yan, tuloy-tuloy pa rin po ang ating pagpabakuna, so wag na pong matakot. Sabihin natin sa ating mga kapitbahay, sa inyong mga guardians, carers of our children, punta na po para maproteksyonan sa COVID-19. And gaya nga po ng sinabi ng ating speakers kanina, sa mga immunocompromised, meron pang 4th dose na kinakailangan, Doc Raymond. So sana, lalo na yung ating mga may renal diseases, on top sila dun sa kanilang schedules. So everyone and anyone who is eligible, magpabakuna na po kayo, lalo yung mga bata. So Doc Raymond.
Thank you, Joy. So we hope you'll be able to share this video clip sa inyo pong mga colleagues, sa inyo pong mga social media networks. Sana po magpabakuna po kayo, papasama na sa Bakuna Center. We also understand that everybody is very busy with their own schedules po, no? And so we have selected a few presentations, very, very consumable ones that we lovingly call SED Shorts. Matatagpaan po siya sa TVUP YouTube channel. If you go to www.youtube.com/TVUPPH, you'll be able to see ito pong mga nuggets of wisdom. Maikli lang naman po itong mga videos na ito. We hope you'll be able to watch them. Maybe when you're riding the train or you have a break, you'll be able to learn so much even in this SED Shorts po. So maraming salamat po sa lahat.
Okay, Doc, ready ka na ba? Pwede na tayong magtanong sa ating dalawang panelists, Dr. CYBELE and then Dr. Romina. May we request you to open there you go. Ako na po ang unang magtatanong dahil meron akong interesting bit na nakuha sa presentation ni Dr. Romina. Ma'am, you said meron po tayong decline nung transplants since nagka-COVID noong 2020, no? Pero medyo tumataas na rin po ngayon nung natapos na or medyo nag-open up na from the lockdowns. Is it a function po of non-availability of donors then that nagka-decline, or it was really just the lockdown? And therefore, is there a need for us to call on those that are eligible and those that kasi meron pong programa no ng NKTI. I remember I had a card nakalagay doon, I am a kidney donor. Ilalagay mo sa wallet mo, if you pass away, whether it's an accident or a sickness, pag nakita nila yun sa'yo, you're automatically given, sorry about the dogs, you're automatically given you're automatically in the program to donate.
Yeah, so the decline in the number of transplants was because we shut down the hospital for elective procedures during the early part of COVID. That lasted about several months. And then, wala pang vaccination at that time. So
Opo.
patients were very scared to go to hospitals, to have their laboratory tests to prepare them for the transplant. Donors also didn't want to come to the hospital.
Right, opo.
Those factors led to the decline. But thankfully now, even when there's a surge, we continue transplantation because we found that patients who remained on dialysis were at higher risk of contracting COVID. And once you get COVID, it really delays your transplant. So it's really better for them to get transplanted as fast as possible because the risk for getting COVID decreases.
Yeah.
What you said also, Joy, was very important. We have to have this um, continuous campaign for organ donation so we can improve our deceased organ donation, kidney transplantation. And yes, we have a very active group now that's really trying to invite everybody to carry that organ donor card that you mentioned. That's one. There is an app that will be launched very soon on a big scale so that all of us can register and be an organ donor. And number three, it's so important, you have to tell your families that you want to be an organ donor because sometimes when something happens to us, we're in the hospital, our family, they don't want to give consent, no? Because they're not aware that we wanted to be organ donors. So you need to share that decision with your family.
Yeah, thank you very much, Doctora, for that information. So, kami po dito sa Stop COVID Deaths, I'm sure Doc Raymond, no, ay tutulong kung kinakailangan magbigay pa ng additional call for donors. Anyway, Doc, pwede na ata tayong mag-umpisa sa mga questions ng ating mga manonood kay Doc CYBELE at kay Dr. Romina. Meron na po ba tayo?
Meron lang mga what do you call this? Consolidated questions that we have right now. This one has to deal with mga immunosuppressive medications. So marami po nagbabanggit po sila ng mga immunosuppressive medications. And so we'll post this to Dr. Penji. The consolidated question is as follows. Are COVID vaccinations still effective even in people who have been receiving immunosuppressive therapy for a long time or yung pong mga at least have been receiving immunosuppressive therapy po?
I think so, yes. The studies have shown that intake of chronic steroids and even other immunosuppression were found to be significant in that those patients will probably not have such a robust immune response to the vaccine. But certainly, that's why we have the boosters, and Dr. CYBELE really explained that very clearly, that for these populations, cancer patients, those who are transplanted, those on chronic immunosuppression, they will probably really be the ones who will require those boosters to bring up their protection level.
Okay. Thank you, Dr. Penji. Very important po. And this one is, ididikit ko lang po ito sa one of our other news updates. It is for Dr. CYBELE. Your opinion, ma'am, on Moderna saying that they are ready to roll out their variant-specific vaccines. Is it something that should replace, maybe, kasi may ganun po mga katanungan, will it replace ito pong mga bakuna po natin? Baka kasi yun lang daw ang tamaan at saka kung baka daw mabuhay ulit sila Delta at saka sina Beta. So, what is your opinion po with regards to that?
Yeah, so the news is very early, it's kind of a breaking news. So we haven't really seen the evidence behind this new Moderna, but it's very exciting. We're all excited to get this new vaccine. They're also trying to build, I think, a pan-corona variant o pan-coronavirus vaccine, para tamaan na lahat ng variant, hindi na tayo umabot sa iba-ibang letter ng Greek alphabet, So perhaps they can do it, perhaps they cannot, because the problem with coronavirus is it's been really very smart. Every time we come up with something, it kind of changes and mutates. It's called, kind of escapes the current vaccines. But this is very exciting. My opinion is that it might replace the current vaccines, because the current vaccines were really built with the original Wuhan strain in mind. And it's really very different now. Napakadami ng mutations from the original Wuhan strain. So the Omicron is kind of almost behaving like a different type of coronavirus altogether. So that's why they're thinking of building these new vaccines. So that's my opinion, that I think the older vaccines will probably be phased out.
Okay, so that's something po of a concern po, I think, although it's much more future thinking in that regard. I know a lot of folks are looking forward to that pan-coronavirus vaccine, similar to yung pong multivalent na pneumococcal vaccine na maraming tinatamaan na ano po. So I don't know if it's they want that in their arsenal, kumbaga, na natusukan na sila para lang hindi po sila tamaan ng kung ano mang variants. This next question comes in po, I think from dito po from the internet na lang po, sige. Dr. Apenji, will the COVID-19 vaccine trigger a relapse? Kasi na dati daw po nagkaroon daw po siya ng nephrotic syndrome. So baka daw bumalik daw sa pagkakaroon ng nephrotic syndrome or maybe other protein spilling diseases. Will the COVID-19 vaccine initiate that kapag natusukan daw sila?
Yeah, that's a very interesting question. And in fact, in that article, Vaccine 2021, they did mention that in some patients, they found that the proteinuria started to increase with the vaccination. But it was certainly not overall. So it's still very important that we observe the effect of the vaccine in patients who have nephrotic syndrome or other proteinuric diseases, and observe if that will happen. And that will be a very important question. Let's ask Dr. CYBELE. Dr. CYBELE, if a patient found after vaccination that his nephrotic syndrome a bit maybe got worse, should they have further vaccination?
So that's a tough question to answer po, ma'am, no? Because the causality is kind of very hard to prove, no, whether it's vaccine-induced or it's just poor timing or whatnot. But in general, you would still advocate for getting the vaccine, because the fact that the nephrotic syndrome came back just says that the patient is at high risk for very bad COVID-19 should the patient get bad COVID-19. So kailangan pa rin kompletohin yung vaccination series.
Okay. So very important po. I don't know if yung ating caller tuloy, no? So nagtanong po with regards to that, narikuha po niya. Pero yun po, kompletuhin ang inyo pong vaccination schedule po, no? Ito naman po very specific, Dr. CYBELE. Yun daw po mga nakatanggap ng mga I guess mga monoclonal antibodies, kasi mga MAB, rituximab, obinutuzumab, etc. Can they get the COVID-19 vaccine?
Yes, they can. There might be a timing issue, though, depending on the type of monoclonal antibody. There are some evidence will say that perhaps you can get it maybe a couple of weeks after your monoclonal antibody dose, no? But I haven't actually looked at that. That was the early recommendation, but I haven't looked at it lately. So baka ngayon pwede nang earlier ibigay, o baka wala nang timing issue, because we've kind of gathered more evidence since we started vaccinating a year and a half ago now, no? So baka pwede nang ibigay earlier, but in general, yes, they can still proceed with vaccination.
Ayun, thank you so much. We will be picking out po from our list of Q&A po, and this one from Munina Santos, Dr. Apenji, yung I think yung kuya daw niya undergoing dialysis 2 beses sa isang linggo. Gusto daw po niya marinig bakit daw po in-advise yung kuya niya na Sinovac na lang ang kunin instead po yung ibang mga bakuna, ma'am.
Well, we tried to look at that, which vaccine was more effective, and there was not really very clear data Overall, I think Dr. Sibel mentioned in her talk, no, that the mRNA vaccines seem to have more efficacy. So personally, parang I would prefer to get the other vaccines rather than the Sinovac, Sinopharm vaccines. Either the mRNAs, the viral vectors, I think, personally, I feel that they are better. Also, internationally, the inactivated vaccines, Sinovac, etc., they're not recognized. Maybe Sibel will want to make a comment on that. So, for example, people who are traveling abroad, they will not accept, certain countries will not accept as that you were vaccinated with, if you will show to them your vac certificate saying that you had the inactivated vaccine. So that's my opinion on that. Sibel, do you want to venture some
Yeah, so so that's I've heard that no from my other patient. Meron namang opposite, meron namang ibang vaccine lang yung pwede and then ayaw nila yung ibang vaccine. So I think that really boils down to the consultant's choice maybe. But if we base it on the evidence, the only problem I have with the inactivated vaccines, which are your Sinovac and your Sinopharm, etc., is the reason why we cannot recommend them for transplant. It's not because we're sure they don't work. It's because there's no evidence. No, it's because it has not really been used among transplant recipients. Kasi karamihan ng transplant recipients, for example, are in the United States or in Europe where they don't use Sinovac. No, so it's unfortunate kung maglabas sana yung China or other Asian countries who do transplant and who were vaccinated with Sinovac. Baka naman pwede. So that's the hesitancy there with Sinovac, no, with transplants. Now, for dialysis, I actually would not recommend any specific brand because I think all vaccines work. And I think at this point, the original vaccines are really very different from the circulating Omicron. So parang all vaccines are in the same not working so well area already with the Omicron. So that's why we're thinking about boosting already, not just the general population, but especially the high-risk patients we talked about.
Thank you. Thank you, Dr. Sibel. This one from Maria Patricia Ludan, but I'll make a little tweak, Dr. Penji. She has a 10-year-old with lupus and compromised kidney function, has received 2 doses of COVID-19 vaccine early this year. My tweak is that timing-wise, kapag ganyan po ba, how early can you receive the booster? Is it just a few weeks after or should really wait parang several weeks? Especially for immunocompromised po, no? I mean, assuming na we have all of the legalities in place po.
I think Sibel should slide on that. Sibel should answer.
Okay, sige po. Dr. Sibel?
So timing, no? So timing of vaccines, no? So typically, the timing is around 3 months after the second dose. That's when they typically start to give the booster, no? So it's kind of a range. It does not have to be exactly 3 months, but that's when we think that the antibodies start to dip and wane below a good effective response. So that's why they start giving it at 3 months. But it can be, 4 months, 6 months. Hindi naman pag nahuli ka, hindi na pwedeng ihabol. No, I wouldn't give it too early because you still have those vaccines that are working anyway. So maybe 3 months and longer.
Ayun, okay. Thank you so much. Joy, anything sa
Yes.
yung call in or meron ba katanungan?
I think, Doc, yung iba nating mga katanungan, pwede na nating ibigay kay Dr. Sibel at Dr. Romina, no, para hindi natin may sa live lahat pero baka pwede nilang sagutin kasi yung mga nagtanong nandito sa ating live stream na nanonood sa atin. And I think right now it's time for our Zoom and Slido results of the fun quiz. Tama ba?
Okay. Yes, correct. Can we have the the fun quiz questions on the screen? There we go. Can we have the one on Slido para lang po makita ng ng ating Ayun, okay. I'll read the questions po, no? And then, first question is for our nephrologist and the second question is for our ID specialist. In Zoom, so ito, basahin ko po muna ang katanungan. Safe bang magpabakuna kung may chronic kidney disease, naka-dialysis, or after kidney transplantation? 87% in Zoom answered po na all of the above. Doon naman po sa ating Slido, 91% naman po ang pumili ng all of the above. So to Dr. Rapenji, ma'am, ano po ang tamang kasagutan for the benefit of our audience, ma'am?
Yeah, tama naman, all of the above. So all of these patients, because they're at high risk for severe disease, high risk of dying if they get COVID, so therefore they should all get vaccinated.
Ayun, thank you so much, Dr. Rapenji. And then for our second question, kung may sakit sa kidney, dapat pa bang magpabakuna laban sa COVID-19 kung nagka-COVID ka na? 96% in Zoom answered po yes. Dito naman po sa ating Slido, 83%. I don't know if there's why the discrepancy, pero 83% selected yes. So for Dr. CYBELE, you're on mute, ma'am.
Sorry, the answer is absolutely yes. No, if you have kung may sakit sa kidney, kailangan magpabakuna despite having COVID, no? Kasi napakaganda ng actually tinatawag na hybrid immunity where you get both the best of both worlds, no? Syempre walang gustong magka-COVID, pero kung nagka-COVID ka na, dagdagan mo pa ng bakuna para mas mabisa yung bakuna, bakuna.
Okay. Thank you so much, Dr. CYBELE and Ma'am Penji. Okay, we are sharing the results and hopefully that's something na maalala po ng ating audience po, no, with regards to the two questions that we have right now. If it's not too much to ask, there's one more question kasi may nag-type in lang po, no, na question. For our nephrologist, Deputy Executive Director DANGUILAN. Ma'am, ano po, meron daw po bang iba't ibang side effect mula sa COVID-19 para sa mga pasyente po na may focal segmental glomerulonephritis, I guess, and then transplant patients? Iba-iba po ba yon yung parang tama sa kanila or epekto sa kanila pagka may specific pong syndrome or sakit po sa kidney?
You mean the type of vaccine according to the type of kidney disease you have? Wala namang
yes po. Opo, parang you receive the COVID-19 vaccine but dahil ito raw yung sakit mo, ito yung specific sakit mo sa kidney, iba yung tama or iba yung side effect, ma'am. May ganun daw po ba?
Wala naman. So we just give it to everybody no matter what your disease is. What's important is that you get vaccinated for this very this horrible disease, no, for our dialysis and transplant population. So we don't choose. Whatever is available, that's what we give to our patients. So I think that's a very clear message. Get the vaccine, no matter what vaccine you have that's available.
Yes, thank you so much. Thank you so much. Sa lahat po na nakikinig, that's really one of our important takeaways po for this webinar. And then we'll move on po. No? I see that the panel discussion poll is on the screen. It is our evaluation poll. The evaluation poll is the only one po that we have. We do not send out a separate form na ini-email or nasa Google Docs for kung ano man. Ito lang po iyon. So, hopefully, those who are in the Zoom or at least are participating in our webinar will be able to enter their answers dito po sa 5-question survey po or evaluation form. It's a 4-point Likert scale. I'll read the questions and hopefully our experts, our panel experts take this time to gather their thoughts and come up with their own, let's say, final messages po sa ating audiences as I read through the questions. First question, the panelists demonstrated thorough knowledge of the topic. So strongly agree, disagree, or strongly disagree. Second question, the panelists were well prepared and organized. Ganun din po. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this Zoom poll po, no, as part of our evaluation poll, and we hope to be able to get your opinions on how you found this webinar po, no, for today's topic, especially as we remember June as National Kidney Month. So maraming salamat po. Back to you, Joy.
Yes, Doc, salamat sa pag-discuss ng ating request na sagutin nila yung ating panel evaluation poll. No? Sabi nyo nga, hindi pa yan magsasara. So we're gonna wait for the inputs of our viewers. But at this point, we'd like to hear we're bringing back and welcoming back our two resource speakers, Dr. CYBELE Abad and Dr. ROMINA DANGUILAN. Ma'am, we'd like to hear from you and your closing or parting words for us po. Maybe Doc CYBELE first.
Hello, just wanted to say thank you again for inviting us. And as parting words, just remember that vaccine efficacy wanes over time. So kinakailangan po ng booster, especially for those who are at high risk of very bad disease. And the booster is actually also called a third dose or a fourth dose, depending on your type of disease or at-risk condition. But hopefully you get boosted and get additional doses if you're part of the high-risk group. So stay safe, because COVID is still around.
Thanks, Dr. CYBELE. Dr. ROMINA, from you po.
Yes, I'd like to thank you for giving me this opportunity to help celebrate with UP National Kidney Month. So this is the month where we remember what's the function of our kidneys, that we have to take care of our kidneys. We should know whether we are at high risk for developing kidney disease. And that is if you have hypertension, if you have diabetes, if you have relatives who have kidney disease or who are on dialysis, you are at high risk. So remember to check your kidney test at least once a year. That's just a creatinine, a blood test, and a urinalysis, and check your blood pressure. We also want to share that the kidney disease population is a high-risk population for severe COVID, and therefore you should have your vaccination, get boosted as fast as you can if it's available from your LGUs, from the places where you work. You have to also remember that continue the precautions that have been advocated by the Department of Health to prevent COVID infection. So wash your hands, social distancing, and wear your mask. So they're so simple, but sometimes we take it for granted. And so if you have kidney disease, you really have to remember to do all of those so that you can prevent yourself from getting COVID-19. So thank you so much.
Thank you, Dr. ROMINA. Doc Raymond, I think you have our results.
Okay, so thank you so much again. Maraming salamat po from the marami po kami natutunan. Personally, marami po kami natutunan sa presentation po ninyo, at talagang halata naman po na pinaghandaan po talaga ang inyong presentations. What we are now seeing on the screen are the results of the evaluation poll. So for all questions, at least 93% of the attendees chose strongly agree. So maraming salamat po, at sana po ay marami po talaga kayo natutunan with regards to our topic today on the effectiveness of COVID-19 vaccine. Sa background po din po na mayroon po kayo mga kidney conditions or kidney diseases po, especially as we remember the National Kidney Month. So maraming salamat po, and that's something that we hope you'll be able to share with those who were not able to watch. Maybe you can invite them to watch in the playback ang ating pong evaluation poll. So thank you so much. To formally close po ang ating webinar, we'd like to hear a synthesis and closing remarks from the Philippine General Hospital's Deputy Director for Health Operations. So without further ado, Dr. STELLA Mariose. Ma'am Stella.
Good afternoon, everyone. Thank you for to our speakers, Dr. ROMINA DANGUILAN and Dr. CYBELE Abad. And to recapitulate the discussion, Dr. Romina Dangilan said the risk factors for severe infections and mortality in COVID-19. She said age more than 60 years old, cardiovascular disease and diabetes, chronic kidney disease, obesity, chronic lung disease, cancer, and organ transplant patients are at high risk for severe COVID. And they had a study in NKTI where 68% of patients were undergoing hemodialysis, 24% peritoneal dialysis, and dialysis initiation was 18%. And out in their study, it came out that the patients who are on hemodialysis had a high mortality of 38%. Those with peritoneal dialysis, the mortality was 20%, and dialysis initiation was 18%. So she explained that patients on peritoneal dialysis did their dialysis at home, and so there is less chance of contacting COVID. And she also stated about the COVID-19 vaccine efficacy in chronic kidney disease patients. She said that CKD class 3 to 5, not on immunosuppression agents, the efficacy of the vaccines decreased because of alteration of the innate immunity, older age, vitamin D, and the lack of erythropoietin. As compared to the patients who are CKD 3 to 5 on immunosuppression agents, they said that chronic steroid use might decrease the generation of neutralizing antibodies. Therefore, a booster vaccine might be needed or considered. Now, those patients, chronic kidney disease on dialysis, they have an impaired immune system, so that this results in difficulty in establishing the sufficient adaptive immunity against SARS-CoV-2. So they cannot produce so much antibodies. Okay, so she said that COVID-19 in kidney transplant patients, the immunosuppressed status of the kidney transplant recipient might contribute to a higher mortality rate. Empirical stepwise reduction in immunosuppression is recommended in patients with high risk of developing severe disease and as a clinical severity of COVID-19 symptoms increases. Now, SARS-CoV-2 vaccination has become the standard of care for the prevention of severe infection in kidney transplant patients. Kidney transplant recipients mount lower antibody response following SARS-CoV-2 vaccination compared with the healthy individuals. So these are very important messages. Now, in the talk of Dr. CYBELE Abad. Nasanay ako sa CYBELE kasi, sorry, CYBELE Abad. Okay, so she defined SOTR, or the solid organ transplant recipient, and immunogenicity is the measure of immune response. Okay? And humoral immunity is the measurement of the antibodies, usually against the spike protein and nucleocapsid and the neutralizing antibodies. And cellular immunity, that is the T cell response. Okay, so she also defined booster and third dose. When you say booster dose, it is the dose of vaccine administered when the initial sufficient response, immune response to a primary vaccine series is likely to have waned over time. So, bumaba na yung antibody level. So, that's why you need the booster dose. What about the third dose? It is the additional dose after the initial vaccine series. Okay, so she mentioned the recent research published in 2021, and recent publications and local data suggest that breakthrough disease is more common among fully vaccinated solid organ transplant recipients than in the general population. So they are more likely to get the infection, even if they have already completed their immunization as compared to the ordinary person. Now, many solid organ transplant develop weak SARS-CoV-2 antibody response even after 2 doses. That's why there is an approval for a third dose. Okay, so here in our country, we are already doing that. Now, the third dose, it is so the take-home point of Dr. Abad is the two primary series has low vaccine effectiveness for solid organ transplant recipient, and a third dose is highly recommended. A fourth dose or the first booster should be also highly considered. So we should have that for our solid organ transplant recipient patients. Vaccine should be given despite having a prior COVID-19 infection. I hope that clears up a lot of questions for all of you. Let's go back to Raymond and Joy. Thank you.
Thank you so much. Gusto ko talaga yung may applause para feel natin na talagang parang live ang ating recognition. But thank you so much po, no? The Deputy Director, Stella. Obviously, people look forward and aabangan po talaga yung synthesis ni Ma'am Stella. And thank you po for giving us really a way to encapsulize po ano po yung pag-usapan for today's webinar. Okay, sneak peek naman po for next week. We hope you won't miss it po, no? So for next week po, napansin niyo po ba na nagkaroon po ng parang another surge ng COVID-19 sa Europe, pero sinabayan din kasi siya ng ng monkeypox, tas may mga balita ni Joy which is sa Spain meron ding cholera. So those things parang what is happening in Europe kumbaga. So at least in our topic po, no, the United Kingdom has been recently parang napansin po natin na naging epicenter po siya ng monkeypox at saka ng COVID-19. So that's something po talaga na we really have to keep an eye on. We will be having really an esteemed speaker po from the London School of Hygiene and Tropical Medicine to give a talk. He's a professor po of emerging infectious diseases, very much of an expert in this field. We've already had him in one of our international international webinars po, no, wherein we had someone from United States and also from Singapore, if I'm not mistaken. So hopefully you'll be able to join us with regards to this topic. And again, we also have a representative po, also an infectious disease specialist from the Philippine General Hospital. So we hope you'll be able to join us next week dito po sa topic po na surge po sa Europe. So susunod na ba tayo? Something that many people are a little anxious with regards to that, lalo na po nung napapansin po na tumataas yung mga kaso, may mga ibang lugar na from level 1, alert level 1, naging alert level 2. So hopefully that's not something na hindi po mangyari dito po sa Pilipinas. Okay, but before we conclude our program, let us first acknowledge the very hard-working team behind the Stop COVID Deaths webinar series. So maraming salamat po sa University of the Philippine System, from the UP Manila National Institutes of Health, National Telehealth Center, the University of the Philippines Information Technology Development Center, TVUP, obviously, which is the Internet Television Network of the University of the Philippines, the Philippine General Hospital, and the UP College of Medicine, and everyone who has helped to make this learning series possible. So maraming salamat po. Without each and every one of you, we won't be able to churn out our quality content week in and week out. And then on your screens, you can watch episodes po. Na-archive po lahat po ng ating episodes. Obviously, after webinar 105, maging 105 na po ang ating episodes in the TVUP YouTube channel. So if you could open your browsers and type in www.youtube.com/TVUPPH. You'll be able to see all 105 webinars. Meron din po tayong part dito with regards to, if you can see on the chat po, no? Kasi meron po tayong alam mo ba, Joy, na meron tayong a little bit na problem kasi I think for several months now, I think at least 3 months, we were having difficulty with regards to some attendees. Hindi raw sila makapasok na parang
Yes.
passcode daw mali or hindi raw sila naka-register or naka-register sila, wala sila natanggap. Something, I don't know if it's a Zoom thing or anything. But at least for those who...
Tech challenge yun, Doc.
Yes nga, yun nga. Hindi ko alam, siyempre sa radyo, di ba? Hindi naman kayo nagkakaroon dati.
Hindi naman medical challenge na yon. Anyway, lahat tayo natuto nitong past 2 years maging advance sa ating pag-iintindi sa teknolohiya. And
Correct.
yeah,
So
so,
for those
ngayon,
who-
Doc, okay naman na yun, I
Yes.
think
Sana nga
na-solve
hindi
yun
na po masyado maulit, although I've been seeing in the email po of stopcovids@up.edu.ph na meron pa rin But for those who are asking, you can see on the chat that has been posted the links to the registration po, no? We hope a lot of you will be able to register. Madali lang po yun, napapalitan lang po yung numero sa dulo from 106 to 110. Makikita nyo po dito on how to register. We continue and will continue to provide credible and accurate information with regards, not just for COVID-19, but for anything, lalo po kung makakatulong po ito. Thank you, Cherry Calderon, for the feedback po. Thank you. Makakatulong po with regards to the healthcare frontline healthcare workers and those who are also really trying to get back to normal. May mga teachers din kasi tayo, Joy, and
Yes.
pharmacists who are joining us. So, I know, syempre, may mga, hindi pa lahat ng mga schools ay nag-face-to-face, although yun ang goal ng ng incoming administration. So
Actually, Doc, yan happiness problem yan di ba?
What do you
Parang ang daming gusto, hindi yung walang may gusto manood. Maraming may gusto manood kaya hindi makapasok. So
so ano pala yun? Ang tawag doon, first world problems, kumbaga.
parang ganon. Oo. And we I think you're continuing to do a good job, and I'd like to congratulate the team because you have won and you have been recognized for all 105 webinars that you've been doing the past years na ba?
More than 2 years, correct.
And I just forgot that award, but I saw it and I congratulated of course Ma'am Nenny Pernia and the entire team, and of course your team in the Telehealth Center, Doc.
Yes po. Thank you so much. And thank you also, Joy, for taking time off from your busy schedule to carve out time para to co-host with me in this webinar. Maraming salamat din.
My pleasure, Doc, and it's a good thing si Doc Susie will be back next week. So abangan niyo po babalik na si Doc Susie. It was a pleasure pitching in for her, and also of course si Doc Raymond is such a fun person to be with always.
Thank you, Joy. Paki-hi na rin ako kay Robbie. Kung nandyan man siya. Okay.
Will do, Doc. Baka nanonood sana.
Yan, okay. Sana, syempre. Okay. So maraming salamat po sa lahat ng ating manonood. This formally closes our webinar for the week. We look forward to your company again on our next Friday. That will be, I think that is the 1st of July. So ano na po yun, new administration and hopefully new hope para sa atin, especially para sa bansang Pilipinas. Sana po makita-kita tayo ulit from 12 noon to 2 p.m. next Friday. It's a date.
Yes, together we can stop COVID deaths. Salamat po.
Keep safe, keep healthy, and see you online.